ladies, please, you might help a fellow listener who might be dealing with the same challenge. So if you have or toll free 866-361-0900. Okay, so we're going to get into our Speak On It segment. So I want to share a little bit about it's just feeling so pulled in different directions. And I also know that it has to be done who's aiming for better health from a nutritional perspective.
I would say the number one or the biggest advice I would give is to get help from a professional. Of course, ideally from a registered dietitian, or even speaking with, if you don't have the time or the access, speaking with your physician, your medical provider, but get
Hey, are you free now?
Yeah.
Okay. Can you come in here?
Come in here.
Well, I'm trying to watch the show.
All right. Okay, I know.
I might cancel restream because it never quite works. I need to have another computer up with just Facebook up, because Rhonda claims it's running, but anyway, that's not what I called you here for. But you can't even click the stream onwards Facebook page.
You can bring the laptop in?
No, there's nothing I can do about it because it's Rhonda. So I requested a meeting for next week. I'll see how it plays through, but
do to be the best at work and at your job and get more hours, and taking that time for your health, to focus in on yourself. In some cases it's even frowned upon to take a lot of time. If you need to take days off to go see your medical
So, the house note needs to be paid for this month. My check didn't go into the account. For some reason, they pulled all the citizens' old information for everything. So that's why I was the only one that didn't get paid. So it's supposed to be in there tomorrow.
Provider. That's not exactly something that is
So the
also
form that needs to be sent in, what specifically?
like for a lot of people, that is a challenge. It's a struggle.
Next year's tax returns which you provided. And just more like an explanation of probably your circumstances and what you're asking for.
So that you were stuck on, and you don't think you can do that part? Yeah, the last
So
one.
what do you think we're asking for? Just like the 2 months to be caught up. Anything beyond that, I don't know if you're in a position to give anything beyond what you owe. You know what I mean? As far as
What do you mean?
So, and some people just don't take that time to keep.
what type of relief can they give, and how far out can they give it? Can it be in a deferment of 6 months? Obviously, it's 2 months what we're behind. Then we get a 6-month deferment, and put that on the back. Long, you know what I mean? I don't know. So I was just what they ask.
Do they have like check marks, or it's just a narrative? Okay, so that one wasn't put back in here. Let's see. There's another one that says mortgage on the thick one.
Keep up with all of those things. So maybe they're not seeing.
And it was like the last packet plus all the information. You can check your folders, but it should make like a folder like that.
I don't got the
With
files
mortgage.
nowhere.
I need to take it out for something, to look at something over a year or so ago. Just a manila for it's I don't have it. So I was gonna say could use that one as a guide. Otherwise, just have to rewrite it.
Their primary care medical provider often enough to where they even know that they should be seeing a lot of different specialists. So, you know, like
Right.
a podiatrist, they may need to see an endocrinologist. Everyone should be seeing a dentist. They should be seeing ideally a registered dietitian. So I feel like for a lot of people, that is the big struggle to just get all of that in place. And again, the time factor, and a lot of people just feeling overwhelmed with things, and a lot of people just
Nutritionist and dietitian Janelle Elegant Ketchum, and we're talking about From Plate to Progress, navigating life with diabetes as an African American woman. Again, we're live on WURD Radio 9, and you can also catch our live stream on Facebook at Community Hero PA. Please call in at 215-634-8065 or toll free 866-361-0900 to answer the question of the day. How do you or your loved one manage diabetes? So just to kind of help us with understanding the magnitude of the problem or who is most affected, could you give us some stats about diabetes? Which ethnic groups are most affected by diabetes? You know, what do those numbers look like overall?
So there are several underserved populations that are most at risk for type 2 diabetes. So anyone of Black, African American descent is at risk. Anyone of Native American descent and Asian Americans are also at higher risk. And also anyone that is of Latin or Hispanic descent is also at risk. So there are several populations that are at higher risk and also at higher risk for having more complications also. So there's and then of all of those populations, of course, as you said before, they mostly have type 2 diabetes. So more than 90% of people with diabetes in the United States have type 2 diabetes. So it's a larger segment of the diabetes population that actually has type 2 diabetes, and it's you know, it's in the millions every year. It increases. You know, more and more. I believe it's at least maybe close to 35 million Americans, and it keeps on increasing. And then there's a high population also that also has prediabetes, and most people with prediabetes, they don't even know that they have it. So
Right.
I think that it's wonderful that you refer your patients that have prediabetes to get nutrition and get that intervention then, because in the past, I would say for a lot of times, a lot of my patient population, they didn't even know that time when they had prediabetes. They had no idea, and a lot of them wouldn't hear anything or wouldn't know until they already had diabetes. So I think it just makes such a big difference for people to know and understand that, listen, I can make lifestyle changes now, and I can even prevent myself from getting type 2 diabetes. This is the time to make changes. And, you know, I would say for many people, especially coming from a medical provider like you, it makes a big difference for them to hear it from you and to hear that it's important. Because I think if they kind of see the numbers themselves, and, you know, even if they come by and see me on their own, they don't hear it from a medical provider, they may not think it's as important, or they may not think that, okay, I can really make changes now and prevent the onset of type 2 diabetes and prevent the future complications. So I think that's a great time to make changes, and maybe even before that. Honestly, I feel like for everyone, especially if diabetes runs in your family, if you have any sort of risk factors, and if you have a challenge where you work a lot, you don't have time to focus on your health, I feel like for all of those people, they really should take that time to see a registered dietitian. I feel like it should be part, like how every year everyone has a physical, I feel like they should see a registered dietitian at least once, in my opinion, because that's a great way to prevent even the pre-diabetes, to prevent that also. So
Right.
I think that's a great
Great
thing.
nutrition it really is the cornerstone of good health. I wanted to kind of help the audience to understand how we define prediabetes. Now, you know, are there things happening in the body even before you start to see your labs abnormal or before you reach a certain threshold? Absolutely, which is why, you know, if you have this nutritional advice, you maybe could even prevent prediabetes. But I think of the testing that I'm doing when people come and have routine labs as sort of like a colonoscopy. By identifying this issue, we can actually take steps to intervene so that we can prevent this condition. And so two ways we define it are if you have a fasting blood sugar level that is over 100, or if you have a hemoglobin A1C level that is 5.7% or above. Now, these are two laboratory tests that are part of my routine labs. Unfortunately, I hate this about the rules with Medicare. I can't do this hemoglobin A1C testing and have it covered by Medicare in a person who does not already have diabetes. So you have to already have diabetes if you have Medicare
For,
in order to get a hemoglobin A1C test, which is, that's a little bit frustrating to me because many times there are patients I have who I already know they have this condition and I want to monitor it, but once they, kind of hit 65 and now they're on Medicare, then I'm a little bit more constrained in terms of the labs that I order, unless they're willing to pay out of pocket for the test. So that's something that I hope the rules catch up with the science so that we can continue to monitor that. So ask for those tests, make sure they're being done. Many times people are visiting the emergency room and they're thinking, well, I was just at the emergency room and they checked my labs. And I'm like, the emergency room is really not concerned about your A1C. They aren't. They're there to figure out if you're having an immediate life-threatening emergency. If not,
I didn't give her a script for that.
they are trying to get you out of there. And there are tests that do sometimes overlap with the things that we're checking for your routine health, but many times people have a misguided perception that everything that should be checked for your basic health is being checked in the emergency room. So establish that regular care. It is very important. When people, you mentioned that some people come to you on their own. Is that how most people seek out your services, or are most people referred by their physician or other healthcare practitioner?
So I would say maybe at least 50% of the people come through a combination of either on their own, or actually a lot of them really hear through their work. So a big part of what I did with my practice early on is that I collaborated or partnered with a lot of different organizations, whether it was certain unions or certain different work settings. So I have a big partnership with transit employees locally here. So a lot of them actually, they see us at work and they're told about our services through their work. And then I would say that other 50% is more from being referred from their primary care or from other specialists. And some actually get referred from from other people, from other either friends, family members, and then some actually seek out. So either they've asked their physician, or they have asked called on their health insurance company, or they've just looked up for the services on their own. So it's really a combination of a lot of different ones. I definitely feel that for a lot of people, and especially with the population that I work with, which is predominantly Black and African American, I feel like a lot of people either they don't think that the services are covered by their insurance, or they don't think it's very accessible. They don't think that maybe anyone has flexible hours, or they have virtual capabilities, or they're even at their job. So we've been, my team and I, we've been going on site to a lot of different work sites for well over 10 years now. A lot of people are even surprised that the services are right there. So and very accessible. So I think there are a lot of different thoughts with that, where a lot of people just feel like, oh, it's not accessible to me. Only, maybe that costs a lot of money, or it's just out of my reach. So I feel like hopefully more people will, ask more about it, do some research, or seek out to see a registered dietitian. Many of the health insurance plans no longer require referrals, so people can come in on their own. Medicare, of course, does still require a referral, and some of the HMOs, but some have actually removed it because they don't want there to be a barrier with getting these preventative services.
Are there certain health conditions that people should, or that are typically, reasons that your insurance company see as valid reasons for you to get care from a nutritionist, or is it just anyone who eats food has access to this service?
So there are some health insurance companies, some of the commercial plans, which don't have any designated medical conditions. They want everyone to come in even for prevention. But Medicare, which is, of course, the big determinant for everything, and they kind of set the gold standard for everything, they only have two conditions that they cover. So one is diabetes and the other is chronic kidney disease. So my in my field, a lot of us have been trying to lobby for a lot more conditions to be covered, but unfortunately, that's where it is right now. They're not even covering prediabetes, which does not make any sense, because of course, if you could prevent diabetes, then that will prevent a lot of costs for
You don't even want us to
medical
discover
conditions.
because we can't do one of the major tests we use. So
Exactly. So it just it's mind-boggling that in this day and age that it's something that makes so much sense, that can cost, save so much millions of, if not billions of dollars.
I think it's over $30 billion, the cost burden of diabetes in this country alone, and worldwide it's a huge problem. But I think in this country alone, at least 10 years ago, it was like 30 billion. So I'm sure it's more than that. So yeah, this is something that's really, really huge, really important thing. Now, I wanted to make sure we had time to get into this African American food pyramid and just some basic guidelines from your perspective or recommendations of, how to approach or provide a framework for nutritional habits, because it's not just, a lot of times I find myself focusing on people's weight because it is so common, and we know that can be a risk factor, but it's not the only thing. And good nutrition is about what you're putting in and not just what you're keeping out. So I wanted to make sure that you have some time to give us an overview of this and, some of your best nutritional advice, if we wanted to put it in nuggets form.
Yes, so that is a great topic. So something that I like to talk about a lot about with that is that if you eat in a certain way that's very balanced, you can eat your cultural foods and still be very healthy. A lot of times I always compare, because we hear it a lot. You hear it a lot, I'm sure, in the, on the medical side, medical field, and as far as studies, the number one eating plan or recommended plan a lot of times is always the Mediterranean diet. We hear so much about it. But what a lot of people don't know is that that's just a style of eating. So you can eat cultural foods, African heritage cultural foods, and get the same benefits, health benefits, with managing or preventing type 2 diabetes with eating your cultural foods. So with that plan, basically the foundation of it is eating more produce. So you're eating more plant-based foods. That's the majority of what you're eating. So you're eating a high amount of the non-starchy vegetables. So that could be whatever it is you like. It could be collard greens. It could be, I encourage everyone to eat okra a lot. I've been noticing that a lot of people in the area they're not a big fan of it, but it's so healthy for you.
So much of it summer too. I love okra.
And freshly grown is the best, right? Oh my gosh. Yeah.
But you got to pick it at just the right time.
Yes, that's true. Very, very early on. But so that's something that I'm encouraging everyone to try in different ways. I'm actually thinking about doing an okra class cooking class where I'm going to show everyone how to eat it in different ways. So if you feel like you don't like it because it's slimy, we'll make it in a way where it's not. So, eating, like I said, it could be cultural, non-starchy vegetables. It could be string beans. It could be whatever you like. If you like Brussels sprouts, great. If you like different salads, putting it with a lot of cucumbers, carrots, peppers in there, things to bulk it up. So that will be the bulk or the basis or the foundation of what you're eating the most of, especially for your lunch and your dinner meals. And then having a smaller portion of your protein, depending on whatever your needs are. And it could be plant-based, it could be chicken, it could be fish, it could be, if you're doing any red meats, that would be a smaller amount. The foundation for that kind of eating plan is really eating more, I would say, beans, peas, maybe plant-based proteins, and then a smaller amount of things like the turkey, poultry, and then some fish. Fish would be maybe something like 3 to 4 times a week. Salmon, tuna, sardines, and herring. A lot of the omega-3 fatty fish is really promoted with that plan. And then healthy fats. So things like walnuts, avocados. So you can use olive oil, you can use avocado oil, different types of healthy types of oils, and using a high amount of herbs and spices, and fresh herbs is really celebrated. So
Right.
you want to say
I
something
noticed,
about that?
when I like, I'm a half-hearted gardener. I don't want to say half-hearted, a lazy gardener. But herbs, I always try to make sure I have my herbs because I feel like, nobody can really get what you're cooking when you like just have something extra. Those fresh herbs that I grew myself, you can't beat me. My food
You're exactly right, and then you always have it on hand. And if you want like a lazy way, like you're saying, there's so many ways to do it. You can buy now herbs, already grown in soil at your grocery stores now, and just replant it. You just separate them, replant it, and now you look like you grew all these fresh herbs. They last for months at a time. So there are easy ways to do it also.
from my garden. I have a garden behind my office. I used some thyme just last week. Even in the winter, it had snow on
Wonderful.
everything, and the thyme was still green. So,
So there's so many ways to use it, and then even in urban environments, that's another thing a lot of people don't know. You can grow herbs, you can grow certain things even in a very small space, even in a kitchen windowsill, even if you have a small deck. And that's something that I encourage also with all of my clients, with doing things like giving them starter plants, connecting them with local community gardens, and different things like that to get them encouraged to grow different things, whether it's herbs or some vegetables or some fruits and different things like that. So so that also access is not a challenge. But so with that plan, really eating a variety of your fruits, your vegetables, but having that foundation in your cultural foods, if that's that's something that you grew up with and that you enjoy, you don't have to eliminate that. You can still eat a lot of rice and beans. A lot of times, a lot of people feel like they hear negative things about eating rice and beans, but if that's your starch, it could absolutely fit as a quarter of your plate, and it's very high in fiber. But a lot of times we hear a lot of negative things.
in the balance part, the quarter of the plate part. That's where you
Yes, I would say that's the biggest challenge, and especially when you're looking at different types of cuisine, especially in Caribbean cuisine or West African cuisine. A lot of times that's more than half the plate. So those are the parts where talking about just you can still eat your foods, but maybe the way that you portion it might be a little bit different. The other thing is, I think that's a lot different too, is that the volume of those non-starchy vegetables. For most traditional dishes, or when you take your plate out, usually that non-starchy vegetable portion is a smaller part of the plate. So I would say the biggest difference with that plan is that it's the opposite. That needs to be the biggest part. And for a lot of people, that is a big challenge to re-envision or to rethink that, because it's not just a traditional way of how you ordinarily would envision your plate. So I would say that's the biggest thing. But a lot of people are pleasantly surprised that, listen, I can still eat the foods that I love, that I enjoy. And if I just re-envision or, take the way that I balance my plate a little bit, I can still manage my blood sugars. They're surprised to see things like their numbers coming down nicely.
Right.
Even, for a lot of people, if their goal is to have weight loss, they can still have weight loss also with, balancing their plate in that way also. So the other thing that I encourage a lot is just for a lot of people just to get back to cooking. Again, a lot of the clients that I work with, because they're so busy, a lot of people are not cooking or even, eating a lot of their cultural foods that they grew up with as much as I would like to see. Many are just having them on holidays, day to day. They're having a lot more fast food. So that is something that I've seen affect people a lot more in a negative way, because a lot of times when you're selecting fast food, it's not coming with any non-starchy vegetable at all. And, so that's a big hurdle there. So sometimes I have to tackle that with a lot of people.
What you're doing.
Well, this is all excellent information. Again, you're listening to Community Hero Action Group's Her Health Matters radio show. I am your host, Dr. Sophia Shabazz, And we are live on WURD 900 AM, 96.1 FM. We are looking for your calls to let us know how you or your loved one cope with diabetes at 215-634-8065 or toll free 866-361-0900. You can leave a comment on our Facebook page at Community Hero PA, and all your input can help a family member. Again, we're here with Janelle Elegant Ketchum, a certified diabetes care and education specialist and dietitian, and we are talking today. Our title today of the show is From Plate to Progress, Navigating Life with Diabetes as an African American Woman. I wanted to ask two kind of parting questions. One, you started to touch on it, the progress that you've seen people make. You know, can you give us a like a success story of someone and the type of progress you can see someone make with these nutritional interventions?
Don't even say that you were in.
Absolutely. So this is my favorite part of working outpatient with different clients, is seeing that progress. A lot of my clients, I see them for years. So and one of the things that I've just kind of started doing is seeing a lot of clients with Medicaid, and that's something that I have to thank you for. I know you really encouraged me to do that for years, and I finally did it. So years ago, before I had my practice, that's the population that I worked with primarily. And of course, as you know, that population typically has the most hurdles or the most challenges to overcome. So there's a particular client that I've been working with for a while. He had a very high A1C when he started with me, and he had quite a few challenges. One of the biggest challenges is his food budget. So in addition to having very high A1Cs, he had a very limited food budget. So his food budget, when we worked it out, was something like less than $25 a week, and that's for all meals, breakfast, lunch, and dinner. I would say it was maybe $22. So I had to work with him to help him to eat in that balanced way, where you're eating mostly non-starchy vegetables with that limited food budget. So what I was able to do was to plug him into different resources, and some of them were different things like community fridges. Some were different. We have a great organization in our area called the SHARE program that has pretty much food pantries spread out in different communities. So I was able to work it out where he had access to those things, the community fridges, and then also I plugged him into a community garden at no cost, so where he learned how to grow some of his own produce. So with all of those things and his budget, we were able, I was able to work with him to eat in that balanced way, including some traditional African American foods, and to have that core function of eating a high amount of those non-starchy vegetables. So his A1C dropped significantly. He went from something like 9% to now he is at 7%, and he's also working on increasing his physical activity at also at the same time. So that was just one of them. I have also another.
Because we're running out of time,
Sure.
to make sure people understand what the A1C is.
Oh, thank you.
What it is, it's the proportion of hemoglobin, or that's what's in your red blood cells, that has a form of sugar molecule attached to it. And because of how long the red blood cells live, we can estimate your average blood sugar using that marker. So generally, we want that hemoglobin A1C. The goal is for it to be under 7%, so 6 something or lower if we can get it there. For younger people, we might be even more aggressive and say under 6.5%. So when you're getting above 8%, 9%, double digits, we're really start to be concerned about that. So, to have someone go from, 9 something, 10% down to 7% is really excellent progress. So thank you, Janelle, for sharing your expertise. I understand from our executive producer that you are going to be returning on a regular basis to give us bite-sized segments. that will incorporate topics on nutrition, so important for all of our health. So welcome aboard, Janelle. Before you go, I wanted you to let the audience know how they can reach you, how they can access your services.
Yes, so there are several ways. So one is to go through my website, nutritionunlimitedrd.com. That's nutritionunlimitedrd.com. Or you can follow me on social media, on Instagram and Facebook. That is just Nutrition Unlimited. And then also you can call at 267-239-5637. That's 267-239-5637. And we offer virtual and locally in-person appointments. And it's covered by most health insurance plans.
Thank you so much for that and for joining.
Thank you for having me.
Tuned in live to the Her Health Matters radio show with Dr. Sophia Shabazz on WURD Radio, 900 AM, 96.1 FM. We are going to shift gears to our next segment, Policy and Women, where we sit at that intersection of policy and its impact on our health. We have a new mayor in Philadelphia, the 100th mayor, the first woman mayor of Philadelphia, and the first Black woman mayor, specifically my sorority sister, Mayor Sherelle Parker. And she has released her 100-day action plan that summarizes her vision for a safer, cleaner, and greener Philadelphia with economic opportunity for all. We are eager to see how the plan unfolds and its impact on the improved health and wellness of our community. If you have not read the plan, please be sure to do so. You can quickly Google 100-day action plan or Sherelle Parker 100-day plan, and it'll come right up. We must stay educated and up to speed on the action of our leadership if we want to hold leadership accountable and engage in meaningful, transformative dialogue. You can find the plan online on the city's website at www.phila.gov/media. Or again, if you just Google, it'll come right up. I tried myself. There are lots of races this year. Of course, everyone is talking about the presidential election. The longest presidential primary in history, from what I understand, because it looks like it probably will be a Donald Trump versus Joe Biden election again. Go to vote.pa.gov for information on all the races, because each and every one affects our community. Lastly, this Tuesday, January 30th, is Help America Vote Day. You can do your part by helping America vote, becoming a paid poll worker this year. Poll workers ensure that our polling locations are safe and accessible for all members of the community. Visit pa.gov/get-involved to find out more about this paid opportunity. You heard that right, paid opportunity. Some other important dates you need to know. The next election is the primary election, which takes place on April 23rd. The last day to register to vote for the primary is April 8th. The last day to request a mail-in ballot is April 16th. Remember to vote during the primary election, because that election decides who will actually be on the ballot for the general election in November. Before we close out this segment, please remember these 3 steps. 1, educate yourself on all the candidates' backgrounds before voting. You have lots of time to do this before the next election. It is January 28th. You've got until April 23rd to find out the information you need to know about all of the candidates. 2, make a plan. For example, will you need a ride to the poll? Will you be using a mail-in ballot? If you're unsure, you might be traveling in April, go ahead and request that mail-in ballot. And of course, the last step is number 3, go vote. Make sure you do all 3 of those steps in preparation or in the months leading up to April 23rd. Lastly, we're going to move into our Making Moves segment, where we share health-related activities and programs that you may be interested in around Pennsylvania. We've got a lot to share today. According to the CDC, Depression is a true and treatable medical condition, not a normal part of aging. However, older adults are at an increased risk of experiencing depression. It's true that it is treatable, just like diabetes or hypertension is treatable. Community Hero Action Group is addressing this with its launch of the new program, Community Advocates for Senior Empowerment, or CASE for short. The program focuses on providing help and resources for African American seniors who may be experiencing depression. Community health workers work with seniors to assess levels of depression, set goals, connect to resources, and make necessary referrals, all for free. That's right, free. If you or someone you know would benefit from this program, please email Community Hero and contact us at communityheropa.org or message us on Facebook. There's also a $25 Visa gift card provided to participants. Again, please email Community Hero and contact us at communityheropa.org to enroll or obtain more information. Currently, the program is operating only in Montgomery County for now. Next, we want to share important information about the lack of diversity in the mental health profession. According to data from the American Psychiatric Association, only 2% of the estimated 41,000 psychiatrists in the United States are Black, and just 4% of psychologists are Black. On college campuses, only 13% of counseling center staff are Black, according to a 2020 survey. Because Community Hero passionately believes that representation matters, we are proud to announce the launch of Mental Health Professional Fund, which provides financial support to individuals pursuing licensure or certification in the mental health space, from psychologists to counselors. Community Hero recognizes the importance of removing financial barriers, allowing aspiring mental health professionals to concentrate on their studies and clinical training. The funds can be used for their certification or licensure fees, as well as any preparatory course that would assist in helping an individual pass their exam. These funding opportunities are available for up to $1,500 to support your efforts. There's limited funding, so please share and or apply today at communityheropa.org. Send a message on Community Hero Action Group's Facebook page. Get in touch with us.
Yeah, I didn't even get
The CASE program and Excel Fund are supported by the generous support of SAMHSA, the Substance Abuse and Mental Health Services Administration. Next up is a friendly reminder about Community Hero Action Group's 4th annual Pennsylvania Black Health Matters Conference, Release and Restore 2024. It's scheduled from April 10th through the 15th, and you can visit blackhealthpa.org to learn about this year's event, which is centered around mental wellness. The goal this year is to release the stigma commonly related to mental wellness and restore mental wellness. There will be health forums during the week, and of course, the annual festival, the Health in Action Festival in Germantown's Vernon Park on Saturday, April 13th. DJ Diamond Cuts will be there on the 1 and 2, so you don't want to miss it. There'll be live entertainment, food, obstacle courses, free health screenings, and more. We want to see you there. If you're interested in being a sponsor, a vendor, please visit blackhealthpa.org for more information. Mark your calendars, and remember, this event is absolutely free. The conference is free, and but you have to register. blackhealthpa.org to register, become a sponsor, or become a vendor at the health festival. Last but not least, we are all about supporting everything that enhances the health and wellness of African American women. On that note, we want to tell you about Davon Smith, a woman who is constantly inspiring others in the community, her friends, and family to lead a healthy lifestyle through running. She's currently raising funds for her first marathon in London, England. She's racing on behalf of a charity called Sense, which believes that no one, no matter how complex their disabilities, should be isolated, left out, or unable to fulfill their potential. If you'd like to support this cause, you can visit 2024 TCS London Marathon.
800.
@Hughes, ETHUSE.com. Or you can visit Community Heroes Facebook page and click on Davon's post to support. Well, that is all we have for today. It's time to bring this episode to a close. The producer of the show is Community Hero Action Group, a 501c3 nonprofit dedicated to closing gaps in health and wealth disparities in the Black community. If you want to get involved with all the work that Community Hero Action Group does, such as this radio show or other initiatives, visit communityheropa.org or email us at contactus@communityheropa.org. It takes all of us to get the work done.
That's why I don't want to talk to her.
Thank you to our executive producer, Nicole Keels-McGruder, the founder and chief operating officer of Community Hero Action Group, and of course, special thanks to Word's technical producer, Ms. Rhonda Gibson. That's all the time we have for today. Join us next month on the fourth Sunday for another episode dedicated to creating positive health and wellness outcomes in our community. I'm Dr. Sophia Shabazz, your host, and I'm signing off today on this episode of Her Health Matters. Until next time, be healthy, be you, because your health matters.
In your own way. But I thought my mom was just because, hey, it's been a minute. But now, yeah.
What she
See,
said?
she didn't even. I felt like that.
She didn't sound like a panic.
Oh shit!
Like